Hello, my name is Emily, and I will be speaking on behalf of our group that focused on Lewiston, Maine for our population-focused health assessment. So just a bit of background on Lewiston. In the late 20th century, Lewiston experienced rapid industrialization, particularly in the textile and shoe manufacturing industry. So the city attracted a large number of immigrants seeking employment in these industries, as well as job opportunities and this promise of a better life, which attracted people from various ethnic backgrounds. Today, Lewiston is the second largest city in Maine with a population of 37,000, with a demographic breakdown of 87% white, 4.5% Black or African American, and 0.4% are identified as American Indian or Alaskan Native. Within this population, there is a significant Somali Bantu community. So in the mid-2000s, Bantus began moving to the United States, and roughly around 2005, the Somali Bantu people began to arrive in Lewiston, following a large secondary resettlement of ethnic Somalis. So today there are over 7,000 Somalis in Lewiston and Auburn, and over 3,000 of which are Somali Bantu. Now the Somali Bantu community is at the center of Maine's sustainable agricultural development, which a lot of our economy depends on, is fishing and agriculture. In the Somali Bantu Community Association specifically are a group of folks that are farming in Lewiston and throughout the southern Maine area. The Somali Bantu Community Association promote access to growing fresh, chemical-free, culturally relevant produce to themselves and to the Somali Bantu community of Lewiston and to a lot of Mainers. So there are some significant health challenges that are present in Lewiston, specifically the affordable housing crisis. Affordable housing and homelessness are major concerns there, and the cost of housing and living can be a significant barrier for low-income residents, making it challenging to find safe and stable living situations, especially for marginalized and disenfranchised communities. Over 23% of people in Lewiston are living at or below the federal poverty level, and that stat was taken from, I think, a couple years ago, so I believe it has increased since then. In the General Assistance Program, which is a Maine org that helps folks experiencing homelessness, they saw a 330% increase in local need for housing from the previous year. And of that, there was another, or within that percentage, that included 112 asylum-related cases, which was a 509% increase more than the previous year. So to combat these health challenges of systemic homelessness and the affordable housing crisis, there are a few resources available in Lewiston, some of which are the New Mainer Public Health Initiative, which is an organization that advocates, educates, and provides emotional support services to new Mainers, and Gateway Community Services, which is a wellness service for immigrant, refugee, and asylum-seeking individuals. Whoops. So we reviewed two health policies that not only are specific to Lewiston, but the entire state of Maine, one of which is the Institution of Mental Disease exclusions for substance use disorder. And these waivers aim to combat the opioid epidemic and enhance substance use disorder treatment access in the state of Maine. Additionally, on top of this, they sought flexibility to pilot services for Maine Care enrolled parents with substance use disorder who have involvement or at risk of involvement with Child Protective Services. And we've seen a dramatic increase even in the past 5 years with substance use disorder in Maine. So this is huge. Another health policy that we reviewed is the home and community benefits for elderly and adults with disabilities. And this section provides comprehensive guidance on a range of home and community-based health services available to elderly individuals and individuals with disabilities. And these services could include personal care, respite care, home modifications, etc., primarily for folks that cannot go out and get the access to these services outside of their home for a number of reasons. So this slide encapsulates an interview that Maisie had with a manager, Brittany Drudy, who is a medical ICU nurse at Maine Medical Center. And this conversation was primarily surrounded by the mass shooting that occurred last month in Lewiston. So her first question to Brittany was, how does a mass shooting, a devastation, impact the hospital like Maine Med? And she said that there's an increase in amount of people in need to help patients coming in, but not necessarily adequate staffing. There's an increase in supplies that are needed, and there is an increase in emotional support services that are needed to aid to those that experienced acute trauma. The next question she asked was, what steps are put in place when a mass shooting occurs, and how can you prepare for this as a nurse? So code triage is number one, and this was when they sent out a mass text to a lot of nursing staff and healthcare workers to come to Maine Med and help mitigate the amount of people that need help. Another was having a meeting point for everyone to come to and gather and just communicate what is needed in that specific moment. And another was a supply list that was needed for types of patients that were coming in, whether it was from or for pediatrics, adults. And the last question was, what are some ways you and your floor can help communities surrounding Lewiston or surrounding an area that has faced a mass shooting? And Brittany said that sending blood from MMC to Lewiston was huge in that moment, and also sending gift baskets, cards, letters to show that emotional support and just to let that community know that we are there for them. So these are our references, and that is the end of our slideshow.